I want to switch gears into hormone replacement therapy and BHRT, because I know you're a fan, but you also say there's a pitfall to pellets. And many women we've seen at the clinic here, and I hear from other doctors, are really inquisitive about this. Their hormones are off and they want to have BHRT. Tell us about why you believe there are pitfalls of pellets and what you recommend for BHRT.
So I'm a minimalist, whether it's supplements or hormones. I always like the lowest dose possible. With supplements, I don't like formulations where there's 20 different things. I'm kind of like, if we want maca, let's just use maca, and so I'm the same with hormones. The problem that I have with pellets are kind of, and the argument is they've been around forever, but they were used in animals, and they are used in animals. And I just think that to then put them into humans is different. Now, men and women are different hormonally. I'm not opposed to pellets in men, because if testosterone goes too high in a man for a while, I joke and he's just a bigger jerk than he probably normally is. But in women, what I see with pellets, one, they're cash-based, so they're super expensive. They're about 4 times more than just using a cream or a sublingual lozenge. It's a procedure, so you have to go in every 3 months, and it's a pretty thick trocar that they have to put in your backside and deposit this pellet, so there's infections and bruising. But aside from that, the costs and just the pain of maybe putting it in, I have yet to see a study that shows that the levels of especially testosterone, because that's the main one that's used in pellets, doesn't go. I just had a lady in yesterday and her testosterone was over 300, which is a man. That's a man's level of testosterone. And what happens is the companies that make these pellets, it's kind of a buyer's club. So you buy in, you have to pay them a monthly fee, which then just makes you want to use the pellets more because you're invested and you have to buy the pellets. So it's kind of this weird way to do things. So what I see is levels with, say, testosterone goes super high. Now, the problem that I have with this is that they draw blood and then it gets put into the computer, and the company then recommends a dosage. So there's really no art there. There's really no talking to the patient to see how she feels. And then what happens inevitably is they're either putting extra medications in the pellets, like an anastrozole, which helps your body not change the testosterone because it's so high into estrogen, or they're putting you on spironolactone because now you're getting acne. So we're giving you these pellets, the levels are super high, and then we're adding more medications to the mix. The other reason I don't like pellets is because once they're in, you can't take them out. So if your levels are too high and you feel horrible, or you're having some sort of side effect from that pellet, then you're stuck with it for 3 to 6 months. So that to me is just not a good way to do things. And I think the reason that women talk about them or ask about them is because of marketing. And here's the other thing. I call it the Gatorade effect. And I'm not bashing on Gatorade, but it's marketed really well. And it's marketed for thirst. Well, you take a drink of Gatorade and it quenches your thirst, but they put citric acid in it, which then dries out your tongue. So you're thirsty and you want more Gatorade. Pellets do the same thing. So what happens is and every woman will tell you this, I felt amazing for like 2 to 3 weeks. I felt like I could do anything. And that's because you literally just busted through the roof with your hormones, and then they start to drop. And that's when every woman will say this. And then after about 4 or 5 weeks, I was like, oh man, I think I might need a new pellet, because they're not feeling like they did when they were at their peak. The problem is their levels were so high, like sometimes dangerously high, but they felt amazing because, yeah, you're going to feel amazing, but you can only ride that for so long before you start having some negative sequelae, whether it's hair loss or voice deepening or, anxiety, aggression, and things like that. So buyer beware. I think that pellets for me, I don't like them.